Welcome back to Module 2 of 1016 MSc, the Muscular System. This is Topic 2.4, the muscles of the lower limb and other selected muscles. Open your workbooks to Module 2, Topic 2.4, and try to answer some of the questions that relate to the content covered during this mini-lecture. The learning outcomes for Topic 2.4 are to be able to identify and know the actions of selected muscles that move the thigh at the hip joint, posterior and anterior, to identify and know the actions of selected muscles that move the lower leg at the knee, posterior and anterior, identify and know the actions of selected muscles that move the foot and the toes, identify and know the actions of selected respiratory muscles, and to identify and know the actions of selected muscles of the pelvic floor. Some thigh muscles act only at the hip joint, others act only at the knee joint, and others act at both the hip and the knee joints. However, most anterior muscles of the hip result in hip flexion. Anterior muscles of the pelvis that cross the hip joint include the iliacus and psoas major muscles. These are often grouped together and known as the iliopsoas. The psoas major exists mainly in the abdomen, extending from the lumbar vertebrae to blend with the iliacus as it passes the pelvic brim. The fibers of the iliopsoas pass under the inguinal ligament to insert via a common tendon on the lesser trochanter of the femur. Iliopsoas is the prime mover for flexing the thigh at the hip joint. Anterior muscles of the thigh that cross the hip joint include rectus femoris, sartorius, and tensor fasciae latae. Rectus femoris is a superficial muscle of the anterior thigh that originates on the anterior pelvis and inserts via the patellar ligament into the tibial tuberosity as one of the quadriceps muscles. Thus, it has a dual role of hip flexion and knee extension. Sartorius is the strap-like superficial muscle that runs obliquely across the anterior thigh from the anterior superior iliac spine to the medial aspect of the proximal tibia. This makes it the longest muscle in the body, and it also crosses both the hip and knee joints. Sartorius also has multiple roles at the hip joint. Not only does it flex, abduct, and laterally rotate the hip, but it is also a weak flexor of the knee joint. It is often called the tailor's muscle, thought to be so for a number of different reasons. Sartorius comes from the Latin word sartor, meaning tailor. Also, the action of sartorius places the leg in an externally rotated and flexed position, a position often assumed by tailors when peddling older sewing machines. Additionally, the long thin structure of sartorius resembles a tailor's measuring ribbon. Tensor fasciae latae is a smaller muscle arising from the anterior iliac crest and inserting into the iliotibial tract on the lateral thigh. It assists in flexing, abducting, and rotating the thigh medially. The posterior muscles of the hip joint mostly extend the hip. The gluteus maximus is the largest and most superficial of the gluteal muscles and forms the bulk of the buttock muscle mass. It extends from the iliac crest and the sacral to the lateral aspect of the gluteal tuberosity of the femur and the iliotibial tract. It is the major extensor of the hip and also laterally rotates the thigh. Gluteus maximus overlies the large sciatic nerve and is most effective in thrusting the thigh posteriorly when climbing stairs or running. Gluteus medius is a thick muscle, mostly covered by gluteus maximus. It originates from the gluteal lines on the lateral ilium and inserts into the greater trochanter of the femur. It abducts and medially rotates the hip and is extremely important in steadying the pelvis while walking. Gluteus minimus is the smallest and deepest of the gluteal muscles and has a similar function to gluteus medius. It primarily medially rotates the hip with some abduction of the thigh. The hamstring muscles located in the posterior compartment of the thigh include the biceps femoris, semitendinosus, and semimembranosus. As a group, the hamstring muscles also extend the hip, but they have a dual role in that they also flex the knee. A third group of muscles crossing the hip joint are located medially. These muscles all adduct the hip joint. The large muscle mass containing 3 muscles on the medial aspect of the thigh arises from the inferior part of the pelvis and inserts on different parts of the femur. All 3 muscles adduct, flex, and medially rotate the thigh at the hip joint. These muscles include adductor longus, adductor brevis, adductor magnus. In addition to these 3 muscles, gracilis is a long, thin, superficial muscle of the medial thigh. It adducts, flexes, and medially rotates the hip, particularly during walking. All 4 of these hip adductors are innervated by the obturator nerve. The muscles that move the leg at the knee are located in the anterior compartment of the thigh and extend the knee joint. Remember that during development in utero, the lower limb rotates 180 degrees, so that the muscles located in the anterior compartment of the lower limb, inferior to the hip joint, are extensors. Quadriceps femoris is the name given to the group of muscles arising from 4 separate heads, which form the large muscle mass on the anterior thigh. They all insert into the quadriceps tendon, which inserts into the patella, and then, via patellar ligament, into the tibial tuberosity. The quadriceps muscle is a powerful knee extensor, used in climbing, jumping, running, and standing up from a seated position. Rectus femoris extends the knee, but as it has its origin on the anterior, inferior iliac spine of the pelvis, it has a dual role in that it flexes the hip as well. The 3 remaining muscles of the quadriceps group, vastus lateralis, vastus medialis, and vastus intermedius, all originate on the femur and consequently extend the knee. All 4 of the quadriceps muscles are innervated by the femoral nerve. The muscles that move the leg at the knee joint located in the posterior compartment of the thigh are responsible for knee flexion. These muscles are commonly called the hamstrings. The hamstrings cross both the hip and the knee joints and are prime movers of hip extension and knee flexion. Biceps femoris is the most lateral muscle of the group and arises from 2 heads. One originates on the ischial tuberosity and one originates on the linea aspera of the femur. Biceps femoris inserts via tendon into the head of the fibula and the lateral condyle of the tibia. Semitendinosus lies medially to biceps femoris, inserting on the medial aspect of the tibial shaft. And the third hamstring muscle, semimembranosus, lies deep to semitendinosus and inserts on the medial condyle of the tibia. The hamstring muscles all arise from the ischial tuberosity of the pelvis and insert on either the medial or lateral tibia, and they are all innervated by the tibial portion of the sciatic nerve. In summary then, we can see the function of the thigh muscles associated with the various compartments. The anterior compartment of the thigh houses the hip flexors. The posterior compartment of the thigh houses the hip extensors. And the medial compartment of the thigh houses the hip adductors. The muscles that move the foot and the toes, located in the anterior compartment of the lower leg, dorsiflex the ankle, invert the foot, and extend the toes. Tibialis anterior is the most superficial muscle of the anterior leg and is the prime mover of dorsiflexion at the ankle. Additionally, it inverts the foot and provides support for the medial longitudinal arch underneath the foot. Extensor hallucis longus dorsiflexes the ankle and inverts the foot, but primarily extends the big toe. Extensor digitorum longus is the prime mover of toe extension, but also dorsiflexes the ankle. The superficial muscles in the posterior compartment of the lower leg are responsible for plantar flexion at the ankle joint. The gastrocnemius plantar flexes the ankle when the knee is extended. However, because the two heads of the gastrocnemius arise from the medial and lateral femoral condyles and then cross the knee joint, the muscle has a dual role where it can also flex the knee. Soleus is a broad, flat muscle that lies deep to gastrocnemius and also plantar flexes the ankle. It is an important postural muscle that is activated during walking, running, and dancing. Plantaris is a tiny muscle in the popliteal fossa that helps to flex the knee and plantar flex the ankle. All three of these superficial muscles located in the posterior compartment of the lower leg are innervated by the tibial nerve and insert into the calcaneus, or the heel, via the calcaneal tendon. The deep muscles in the posterior compartment of the lower leg are also responsible for plantar flexion at the ankle joint and inversion of the foot. In addition, some muscles from this deep layer cause the toes to flex. Flexor hallucis longus plantar flexes the ankle, inverts the foot, and flexes the great toe. Remember that hallux refers to the big toe. Flexor digitorum longus plantar flexes the ankle, inverts the foot, and plantar flexes the other toes. Tibialis posterior is the prime mover of foot inversion, and also plantar flexes the ankle and helps to stabilize the longitudinal arch under the foot. Popliteus is a small triangular muscle in the posterior knee responsible for unlocking the knee joint from a fully extended position. Contraction of the popliteus flexes the knee and medially rotates the lower leg. All of these deep muscles of the posterior lower leg are innervated by the tibial nerve. The muscles in the lateral compartment of the lower leg are responsible for eversion of the foot and some plantar flexion of the ankle joint. They stabilize the lateral ankle joint by supporting the lateral longitudinal arch. Fibularis longus is the most superficial lateral muscle that overlies the fibula. It originates on the head of the fibula and inserts by long tendon under the arch of the foot on the medial tarsal bones. Fibularis brevis is the smaller of the two muscles and lies deep to fibularis longus. It also plantar flexes the ankle and everts the foot, originating on the distal fibular shaft and inserting via tendon onto the fifth metatarsal. We can summarize the function of the lower leg muscles in terms of the following compartments. The anterior compartment dorsiflexes the ankle and extends the toes. The posterior compartment plantar flexes the ankle, inverts the foot, and flexes the toes. And the lateral compartment plantar flexes the ankle and everts the foot. There are a few other select muscles that we will cover before finishing our Module 2 on muscular system. Let's briefly look at the muscles of respiration and the muscles of the pelvic floor. Let's start with the muscles of respiration. During quiet inhalation, the inspiratory muscles contract. Most important is the diaphragm, a dome-shaped muscle which sits at the superior end of the abdominopelvic cavity. During contraction, it moves inferiorly and flattens out. Additionally, contraction of the external intercostal muscles causes the ribcage to rise and flare laterally. These movements increase the volume of air contained within the thoracic cavity. During situations that demand more forceful inhalation, such as during exercise or in chronic lung disease, additional muscles such as the scalenus, sternocleidomastoid, and pectoralis minor may be recruited. These assist the ribs to elevate even more, allowing a greater volume of air to be inhaled. However, during quiet exhalation, there is no respiratory muscle contraction. Exhalation is a passive process. As the inspiratory muscles relax and resume their resting length, the rib cage descends and the lungs recoil due to their elasticity. However, forced exhalation is an active process that recruits the abdominal muscles, especially the oblique and transversus muscles, to increase intra-abdominal pressure, and the internal intercostal muscles to depress the rib cage, thus decreasing the volume of air within the thoracic cavity. Two paired muscles, the levator ani and the coccygeus, form the funnel-shaped pelvic diaphragm or the pelvic floor that seals the inferior opening of the bony pelvic cavity. Levator ani is a broad muscle that acts like a sling, supporting the pelvic organs, lifting the pelvic floor superiorly to release feces, and resisting the increased intra-abdominal pressure created by coughing or vomiting. Coccygeus assists levator ani in supporting the pelvic organs, as it forms the posterior part of the pelvic diaphragm. The pelvic floor is pierced by the rectum and the urethra, and also the vagina in females. The region inferior to the pelvic floor is the perineum. The deep layer of the perineum contains the urogenital diaphragm, which stretches between the two sides of the pelvic arch. This muscle contains the external urethral sphincter, the muscle responsible for the voluntary control of urination. Inferior to this layer are the most superficial muscles of the perineum, which help maintain erection of the penis and clitoris. Posterior to these muscles is the external anal sphincter, the circular muscle that allows voluntary control of defecation. Try these revision questions now that you have completed this mini lecture covering the muscles of the lower limb and the select muscles of respiration and the pelvic floor. You can make a note of your answers in your workbook. This is the end of mini lecture topic 2.4. Please continue with topic 2.5a.